And what I want to talk about then is there's thing of the whole food complexity, sometimes called the food matrix, and that is that you can take some of these urolithin A precursor containing foods and look at all the other things that are in there. Now, in many cases, that some are known, some are probably haven't even been discovered yet, or those that have been discovered, we don't even know the full story on some of these things. But we have been given these foods over a really long period of time, and they have dozens, if not hundreds, of different compounds in them that have health benefits. And again, you look at these foods and you look at the number of things that there are studies on showing that they're beneficial for. We miss out on all the rest of that stuff, and all we do is we take one particular supplement or molecule. Now, I'm not totally against urolithin A supplementation. I personally probably won't take it, but that's fine. Maybe to my detriment, who knows? I guess we'll find out. But it has some benefits to it. For example, urolithin A, you can standardize and specify the dose. You know that if it's a good company, if you're taking 500 milligrams, you're probably getting 500 milligrams. If you're eating food, that's going to be highly variable, as well as your own microbiome. Concentration is going to be a lot higher than you can get in food. You'd have to eat a lot of pomegranates or pomegranate juice, and then you might have some other problems. And it's super convenient. You just have to basically buy a bottle and pop your pills, and then you're good. On the other hand, whole foods have a whole bunch of other additional benefits that this is not going to have. I'm kind of being kind here when I say limited, but the synergistic effects, there really aren't any. It's a single molecule versus there's potentially a lot of synergistic effects of all the different things that are found in one particular food or food group. The cost is going to be generally higher, clearly, than it is with food, although food's not as convenient. There's limited long-term safety data on this right now that I've seen. It's just months, not necessarily years, especially many years. And in terms of gut microbiome support, it's questionable if this actually does much with the gut microbiome as we've seen right now, although there seems to be some interactions. It's potentially a lot higher when you look at the number of compounds in some of these foods, as well as some of the things like prebiotics. And then other beneficial compounds, again, I'm being kind of kind when I say limited. There's really none except for one, maybe the gelatin cap that it comes in. And it's abundant in these other ones as well.